Okay, so let's do a patient assessment for a potential cerebrovascular accident using the Cincinnati stroke scale. So the first component of the Cincinnati stroke scale is facial droop. So we want to have our patient smile with teeth to determine whether or not they're experiencing any facial droop. Again, we have our BSI and we've done our BSI. We've made sure the scene is safe. We enter the scene. We have an idea of what we could potentially be going into based off the information dispatch gave us. If this is a potential cerebrovascular accident, then we need to ensure that we have continually update the necessary transport centers. So stroke centers in this case would be probably where we would like to transport this patient in order for them to have the highest quality outcome. But first, let's assess them. So we want to have our patient smile, so facial droop. So we want to smile with teeth. If there's a normal smile, if our patient has a normal smile, then we're assuming there's no facial droop potentially indicative that there is no stroke. But if the patient is struggling to smile, if the one side of their smile is kind of lying flat, then that could be indicative of facial droop, potentially pointing to signs of a cerebrovascular accident or stroke. And then the next test we want to do is the arm drift test. So we want to have our patient hold their arms out in front of them with their palms up while their eyes are closed. During this test, if the patient's arm drops down due to weakness caused by stroke, then it's indicative that they are having a cerebrovascular accident or a stroke. And in that case, then we would want to do our final assessment, which is speech. And we would want to have them repeat this phrase to us: "You can't teach an old dog new tricks." I almost said it wrong there. So you can't teach an old dog new tricks. And so in having this patient repeat that back to us, we could be assessing for appropriate responsiveness back to us, appropriate functioning of the language centers of the brain as well, that could be impacted were the patient having a cerebrovascular accident or stroke. And so in doing so, we're allowing our patients to basically, following the Cincinnati stroke scale, determine whether our patient is having a cerebrovascular accident and whether they could be having, and whether or not that they had or are currently having a stroke. So once that we've determined that, we wanted to make sure we do the final component, which is to transport this patient rapidly to a stroke center in order for them to receive the appropriate care and deliver the highest quality outcome for them.